Hi everyone, so in this video we are going to take a look at a pig heart. And with a pig heart, so pigs are mammals, so they also have a four-chambered heart, as we do, so we will explore all four chambers together with this video. And before we do so, we're going to start with some of these external structures that we see with the heart. So first off, we need to talk about coverings of the heart. And the first covering that we can see right here is this bag-like structure. And this bag-like structure, this is what we refer to as the fibrous pericardium. We can see a lot of adipose tissue, so you can kind of see this yellowish tissue on the surface here. This is a lot of fat just on the surface of this fibrous pericardium. We'll discover a whole lot more once we look on the inside. And with the fibrous pericardium is an inextensible sac or bag-like structure around the heart, as you can see. There's not stretch to this structure. I can pull on it, and very, very minimal. It's non-extendable. So this is going to provide some protection for the heart, not going to allow the heart to fill more than capacity and so on, and also allow some support and structure for the heart, as we can see. And on the other side of this fibrous pericardium, we are going to find the two layers of the serous pericardium. So in between this fibrous pericardium and then the serous pericardium, there is some fluid, so pericardial fluid. It's a type of serous fluid, and that's going to help to protect against friction, so minimize friction when the heart is beating on the inside of the sac-like structure. So first thing we need to do with this dissection is let's go ahead and remove this fibrous pericardium. So I'll use some scissors and just kind of snip away at this fibrous pericardium. Okay, just remember it's inextensible structure that surrounds the heart. And once I take this off, we'll have a nice clear picture of what we see with the heart anatomy a little bit better. So it's almost like I'm unwrapping a present as I'm taking the heart out of this sac-like bag, as we can see. I'm going to do my best to snip this off without damaging any of these vessels. And when they prepared this heart, they did snip a number of these blood vessels very close to the surface of the heart. So they almost look more like openings, as we can see right here, opposed to an actual intact vessel. So here's another opening, and these openings are those blood vessels. So as we go through, we'll try to determine which blood vessels they are. And like I've mentioned in class before, easiest way to go about figuring out what these blood vessels are is simply to place a dull probe or your finger, pencil, something into these openings and kind of see where you pop out. And that's going to give you a big clue as to what structure we're dealing with, which blood vessel we're dealing with. I'm just about done snipping off all this fibrous pericardium. There we go. We can see this is it right here. So it is this inextensible sac-like structure. Okay, so fibrous pericardium. I'm just going to dispose of this. All right, so now we can see the heart a little bit better. You can see some of the structures. We can start to kind of orientate ourselves to the heart and figure out what is the anterior, posterior surface of the heart, which is which. I can see some auricles here as well. You can see a number of great blood vessels here. So with the heart, in lecture we talked about the left side of the heart versus the right side of the heart. So recall that the right side of the heart is responsible for pulmonary circulation, so delivering this oxygen-poor blood to the lungs, and the left side of the heart is going to be responsible for systemic circulation and thus delivering oxygen-rich blood to all the cells and tissues of our body. So that being said, because the left side of the heart has a much larger job to do. It has to push blood a further distance. The muscle, the myocardium of the left side of the heart is considerably thicker than the muscular wall on the right side of the heart. So looking at these two, if I were to kind of push in on this side versus this side, there's not much movement here on this side, which is telling me that this is extremely thick. And over here, I can kind of push in a little bit. There's much more give. So looking at this heart, this is the left side of the heart. This is where we're going to find the left ventricle. This is your interventricular septum. It's a septum. It's a wall that's going to divide the left ventricle, which is here, from the right ventricle, which is here. Okay, and then as far as the atria, best way to find the atria, so the atria are the receiving chambers, would be to look for the auricles. So the word auricle comes from the meaning ear, and we talked about the auricle when we went through ear anatomy. So the fleshy ear kind of hanging off the side of your head, that's referred to as the auricle. So here, these kind of look like dog ears. So this is an auricle. And then over on this side, here's another auricle. So these two auricles, these are going to tell you the location of the atria. Okay, so we're going to have left atrium is going to be in here, right atrium here. Okay, so we can see some blood vessels here. So this is the anterior side of the heart. This is the apex, or the point of the heart, which is going to point to the left. Okay, 2/3 of the heart sit left of the midline of the body, 1/3 of the heart right side of the midline of the body. And so this is the apex of the heart, the point down here at the left ventricle. And the base of the heart is all up here. Okay, so if I turn it around, this is all the base of the heart. This is where we're going to find all of these vessels. Okay, so the base of an organ is kind of the widest part of the organ, which is here. Okay, and the apex of an organ is the point of the organ, which is down here. Okay, so to make our incision, now that we know how this heart is situated, what you want to do is you want to do what we call coronal cuts. Okay, so coronal cut is the same type of a cut that we did when we cut the eyeball. And with a coronal cut, you're going to end up with an anterior side and a posterior side. And the best way I think to go about kind of starting this would be, let's start down at the apex and start to make an incision. So I'll use a scalpel to initiate this incision, but I kind of want to do my best to, here we're looking at a lateral view of the heart. So this is the left side of the heart. And we want that incision to hopefully give us a good view of all of the atria and all of the ventricles. So I'm going to spin this around just so I can see it a little bit better, and then I'll spin it back around so you guys can kind of have a nice view of the great vessels we can see up here. I'm going to do my best. Just kind of cut through the apex here. Move laterally, like so. Going through an auricle. Bring it around, find where that incision is at, and just kind of continue it on this side. So we talk about location of the heart. We know that we find the heart within the mediastinum, cavity of the chest, region of the chest, which is found within the thoracic cavity. So remember, the thoracic cavity consists of the mediastinum, where we find the heart, and then also the pleural cavity. So pleural cavities, we have a left pleural cavity and a right pleural cavity. The left pleural cavity is going to house the left lung, and the right pleural cavity is going to house the right lung. So almost all the way through. That's looking pretty good. There's a lot of muscle inside the heart, so it's kind of difficult. I'm cutting through some of the chordae tendineae right now, which are these string-like structures, literally your heartstrings, that we find on the inside of the heart. Oh, that looks amazing. Let's see. Cut through that valve. Okay, as you can see, we're getting a nice cut through the heart. Okay, so you can see that looks great. I'm going to actually, I'm just going to continue and give myself 2 separate pieces. All right, let's take a look at what we got here. So here we can see the inside of the heart. So a few things we can notice right away is how incredibly thick the muscular walls are of the heart. So we can see this open cavity here is a ventricle. This open cavity down here, this is another ventricle. And it looks like there's not much space inside these ventricles. This is a preserved heart. So if we had a fresh living heart, of course, these cavities will be filled with blood and would be much more expanded. But one thing we can note is difference in thickness here of the right ventricular wall compared to the left ventricular wall. Okay, so the wall left ventricle, much thicker than the wall of the right ventricle. Compared to the atria we would find up here. So this location, grab, I have a dull probe right here. So this is going to be your left atrium, and then your right atrium would be up in here. It might be easier to find on the other side of the heart. Sometimes it's tough to go through. Yeah, so right in here inside this auricle, this is where we have the right atrium. Let's get this guy out of here. Okay. So before we go into chambers and blood vessels and all of that, let's have a quick review of coverings of the heart. So we talked about the pericardium, the fibrous pericardium. The inside of that fibrous pericardium, you find the parietal layer of the serous pericardium, and then we have that serous fluid, the pericardial fluid to minimize friction. And then out here, okay, this is all what we refer to as the epicardium. So the outer wall of the heart, also known as the visceral layer of the serous pericardium. So for simplicity's sake, most people refer to it as the epicardium, but it is known as the serous, the visceral layer of the serous pericardium. So epicardium, and this is all myocardium. This is the muscular wall of the heart. So myocardium, myocardium, myocardium. See how thick that muscle is. And then lining the inside of all of the blood vessels, all of the chambers of the heart, making up the covering of all these valves of the heart. This is all what we refer to as endocardium. So endo means within. So we have the endocardium within, myocardium muscle, epicardium on the heart. So epi means on. Okay, so endo, myo, epi. All right, so now looking at the heart, I suppose we'll start with the atria. So the atria, we have left atrium and right atrium. These are going to be the receiving chambers of the heart. So when blood first arrives at the heart, it's going to arrive via the superior vena cava and the inferior vena cava, which we'll do our best to locate on this heart. The vena cava typically are pretty flimsy, and it's tough to find some veins with the heart, but we know they are going to spill directly into the right atrium, which is located within this structure right here, which we can see if I turn it around. You can see the little ear-like flap. This is the auricle. So within it, this is going to be the right atrium. And we know it's the right atrium because this is the left side of the heart, how thick that wall is. So left atrium's up here. So this is the right ventricle, so right atrium is up here. So if I'm just going to kind of explore the other side and see if I notice any vena cava on this side. If not, I'll explore this side and take a look here. So let's see. And there goes the auricle, so we won't be using this side. So if we look over here, I believe this structure right here. Very flimsy. This is a vein. We can see how flimsy this structure is, where arteries have a much thicker muscular wall, as we discussed in lecture. So this, if I show you a better orientated heart, this is the inferior vena cava as we're coming up into the heart. So if I kind of travel through here, let's travel through with this probe. Let me see where I travel into. I can do this without destroying too much, messing up a little bit of adipose tissue. Let's see, let's try the other end. If I can get through. It's really nice when we have the ability to have a fresh heart, because there's a little bit more flexibility to the heart and a little bit easier to get through. Here it's kind of convoluted, and a lot of the structures are very difficult to maneuver and kind of get through. So as I'm kind of fighting to get through here, what's going to happen? There we go. All right, so right now you can see where I'm popping into. So if I look back here, this is the inferior vena cava, and as blood travels up into the heart, it's going to spill into the right atrium, which is right here, and that's where I'm popping through. So I'll pull this back through. So those are inferior vena cava, and then the superior vena cava is going to be the opening up on top, which is this little flimsy opening right here. This is a superior vena cava. And if I travel through here, okay, so we can see right now I'm in the right atrium. Okay, so superior vena cava coming down, inferior vena cava is coming up from the bottom. Okay, so that's oxygen poor blood traveling through the vena cava into this right atrium. So from the right atrium, now we're going to head down to the right ventricle. And as we travel down to the right ventricle, what we're going to pass through is a valve. So if we look in here, if I can open this up so we can all see it a little bit better, we can see there's a valve in here. Okay, so I'm kind of pulling on the valve. Down here you can notice some strings. Okay, so these are literally heart strings. They are called chordae tendineae. So the chordae tendineae are these strings of the heart, and they're connected to a very thick muscle, which will be much easier to see on the left side when we look at the left ventricle. Very thick muscle down here known as papillary muscle. We can see the right, this is known as the AV valve, so the right AV valve, also known as the tricuspid valve, because there's 3 of these pocket-like flaps of tissue. So tri means 3. So here I'm just kind of removing a little bit of one of the valves. You can get in here and see a little bit better. Let's see, you can see some of the strings right here. You can also see some of the strings right over here. You can see the valves quite nicely. Okay, so right AV valve, it's called the right atrioventricular valve between the right atrium and right ventricle, also known as the tricuspid valve, as there's 3 pocket-like flaps of tissue. Chordae tendineae are these little string-like structures that connect to the papillary muscles, and they're going to help regulate closure of the valves. Okay, and the valves are present to prevent backflow, because you don't want blood to travel back up into the atria. You want the blood to exit the ventricles. Ventricles are pumping chambers, so when blood leaves the right ventricle, it's going to actually leave the heart. Okay, so blood is going to leave the heart when we leave this right ventricle. The blood is oxygen poor because it just returned from all the tissues of the body. So this blood is going to travel to the lungs. So if we look at arteries, arteries always carry blood away from the heart. So the blood vessels that are going to carry the blood from the ventricle to the lungs are known as the pulmonary arteries. So when we leave this ventricle, best way to kind of find where the, we're not going to be able to see the valve. Okay, So as we leave this ventricle, it's kind of tucked underneath in here, we do have what's known as a pulmonary semilunar valve. And pulmonary semilunar valve has 3 pocket-like flaps of tissue. Both of the semilunar valves have 3 pocket-like flaps of tissue. But that's now the blood is traveling to the lungs, and it's going to drop off that carbon dioxide and pick up that oxygen, and then blood is going to return back to the heart, and we're going to return to the left side of the heart. Okay, so left side of the heart is over here, and our receiving chamber, of course, is the atria. So we're going to take a look at the left atrium, which is right here. Okay, so right here, and we can identify this as the left atrium. Again, if I turn it around, here we can see the auricle. So this ear-like flap of tissue. So this is our receiving chamber. This is going to be our left atrium right here. And the blood that's carrying back to the, that's being carried back to the left atrium is going to be carried through the pulmonary veins, because veins always carry blood back to the heart. There's a pulmonary vein right here. Okay, going to bring that blood back to the left atrium. Right now that blood is oxygen rich. It's going to fill this left atrium with oxygen rich blood, and then we're going to carry that blood on down to the left ventricle, which is here. This is all left ventricle, and we're going to pass through a valve. So of course the valve is known as an atrioventricular valve. This would be the left atrioventricular valve. It's on the left side of the heart. So this is the valve right here. Okay, you can see the pocket-like flaps of tissue. On the left side of the heart, the left AV valve is also known as the bicuspid valve. Bicuspid because there's 2 flaps of tissue. And it's also known as the mitral valve. The most common name that people refer to it is mitral valve. Let me show you this side, because I think the valve actually looks better on this side. So if we look here, this is the left side of the heart. So here we can see the pocket-like flap quite nicely. See some forceps. You can see, so here's a pocket-like flap of the valve. Here's another pocket-like flap of the valve. And we can see these heartstrings, these stringy structures quite nice as well. And they're going to be connected down to these papillary muscles. And let me actually remove a little bit of this tissue. I am going to remove a little bit of papillary muscle, but that's going to allow us to see some more underneath. We can see this big, thick papillary muscle right here. And then, of course, we can see all of these chordate tendonae, all of these strings, all of these heartstrings. And I can see how great this chamber actually is. A very smooth papillary muscle, very strong on the left side of the heart. Okay, just like very thick muscular wall on the left side of the heart, as the role of this left ventricle is to push that blood out of the heart into all of the tissues of the body. So it makes sense that it has a very thick wall. Okay, and of course this valve, the mitral valve, most commonly replaced valve in the heart, just due to the great amount of stress and pressure, imposed on this heart day in, day out. Okay, there's a lot of pressure built up in this left ventricle, and we need that valve to close so we don't have prolapse and the blood comes back up into the atria. Okay, so after traveling to the left ventricle, let's go back to this side of the heart because it looks a little bit better. Okay, so here we travel from the atria down to the left ventricle. Now we need to pump that blood out of the heart, this oxygen-rich blood out of the heart. And when we do so, we leave via a semilunar valve. And this semilunar valve is known as the aortic semilunar valve. Okay, right here. It's going to have 3 pocket-like flaps, basically 3 of the valves of the heart have 3 pocket-like flaps. The only one that has 2 is going to be your bicuspid mitral left AV valve. But back here, this is your semilunar, aortic semilunar valve. So blood's going to come this way, pass through that semilunar valve. And the semilunar valves don't have these heartstrings, these chordae tendineae. And as we exit the left ventricle, we enter into this huge blood vessels we see right here. You can kind of see like a pink color to the walls, very, very thick. This is the largest artery in your body. So this is what's known as the aorta. Okay, so the aorta is here. And we're going to carry blood to all of the tissues of your body via that aorta. And then on this side, we can see it yet again. So right here, left ventricle, and as the blood comes up and exits, this is your aortic semilunar valve. We're going to come up and enter into this very large blood vessel, which is the aorta, which is known as an elastic blood vessel because it can stretch and then recoil, which is necessary to allow that pressure to be carried forward. All right, so that is a look at this pig heart with all 4 chambers, all 4 valves, and we saw the blood vessels carrying blood to the heart from the body, and then ultimately to the lungs, and then from the lungs, and then of course from the heart to the body.